Beautiful people, welcome back to our channel NEXUS TV Uganda. Thank you for tuning in with me, your favorite healthcare provider Nachaze Aisha, here to talk about your sexual and reproductive health. My people who are in a Germany district, please feel free to drop by my clinical office to discuss your SRHR with me and all other issues concerning your health. This week we are back with another segment on a related topic, which is PIDs. So I know a lot of you have gone to different clinics and hospitals and you've been told that you have PID and you are wondering, what is a PID? How do I get a PID? What signs do I have to tell that I have a PID, and how can it be treated? Today we are going to get into it. But before we go any further, I would like you to take a second to check that you're subscribed to our channel. Please like the video and ensure to share with all your friends, and also don't forget to click on the bell for notification whenever we have a new video uploaded. A PID is basically in full what we call a pelvic inflammatory disease that carries a fetus when a woman is pregnant. And that is also coupled with the neck of the uterus, which we call the cervix, that then opens into the vagina, and then the outer parts or the external genitalia that you see with your eyes. So the infection typically causes inflammation of the inner linings of the endometrium, which we call endometritis, and then when it goes into the tubes, we call it a salpingitis. To the ovaries, we call it an ophritis, and when it's in the tubes and the ovaries, we call it a salpingo-ophritis. So we are going to be looking at how a PID comes about. And typically a PID is caused by a group of bacteria, commonly Neisseria gonorrhoeae and another bacteria called Chlamydia trachomatis. These are responsible for causing gonorrhea and chlamydia respectively. PID has been seen to commonly occur among women who are below the age of 30, commonly among women between 15 to 25 years old. That we see that PID in most cases will come when you have unprotected sex with multiple sexual partners. This bacteria can also be introduced into the reproductive tract besides sexual intercourse, maybe through procedures such as abortion. It can also be insertion of an intrauterine device, or any other gynecological procedure could cause one to have these bacteria introduced into their tract. There is no specific test for PID, but typically the tests that we are going to do at the hospital are going to depend on the signs and symptoms that you present with in order for us to do an empirical treatment. So generally women having a PID in most cases will present with a lower abdominal pain. Sometimes it can be a left lower quadrant pain or a right lower quadrant pain, but in most cases the women will also present with a bilateral lower abdominal pain. And also we have to note, it's important to note that it's not all the time that PIDs will come with signs and symptoms. Sometimes it's asymptomatic. So some of the other signs and symptoms are an abnormal vaginal discharge. You realize that you have a lot of discharge, and in most cases it will be present with a very foul smell. Another sign and symptom could be painful sexual intercourse, although this can also be a sign of another pathology. When you go to the hospital, your healthcare provider is going to do a pelvic examination for you, in which normally when a PID is present, the client presents with what we call a cervical motion tenderness. That means that in case we move your cervix, there is going to be a lot of pain, and your provider is going to tell you about what you're going to feel and what the examination is aimed about. Tests done in the event that someone has a PID will range from a swab, where we do a gram stain to find out which bacteria are causing the disease, and then other tests may include an ultrasound scan to find out if you have things such as a tubo-ovarian abscess, which will then need to be drained under a laparoscopy, where your provider is going to best to do empirical treatment with antibiotics. Now we advise that both partners get treated. In most cases, men do not want to come for treatment because they say, no, for me I'm okay, I'm not feeling any signs and symptoms. No, we treat both partners. The partner also has to get treatment in order for the person to be okay, and in most cases PID is handled as an outpatient case. So you come in, get your treatment, and then go home. The disease will only be handled as an inpatient case if we have different complications presenting, such as vomiting, nausea, and fever above 38 degrees Celsius. So pelvic inflammatory disease typically causes scarring, especially within the fallopian tubes and adhesions, and this is where we develop those complications such as infertility. Some mothers will face infertility, and also complications such as ectopic pregnancy, where after fertilization the fetus starts growing within the oviducts instead of in the uterus. So in summary, PID is simply an inflammation of the inner lining of the reproductive tract, of the upper reproductive tract, and this will typically cause scarring and adhesions, and that is where we talked about the complications that arise from it, including infertility, ectopic pregnancy, and we said it is typically caused by bacteria, Neisseria gonorrhoeae and chlamydia trachomatis, which are the cardinal causes of gonorrhea and chlamydia. These are sexually transmitted infections. So my beautiful people, you want to make sure that if you're to have sex, you're using protection, please. If there is no glove, there is no love. Use your protection, wear those condoms, please. And also, we also want to preach abstinence. It's also okay to abstain, young people. Abstinence is actually the best way to prevent an unwanted pregnancy and sexually transmitted infections. Please keep safe and take care of yourselves. Now, do not forget to tune in every week for another video concerning your sexual reproductive health. Do not forget to subscribe to our channel, Nexus TV Uganda. Share with your friends. Click on that bell for notification whenever we have a video uploaded. I am Nachaze Aisha, your favorite sexual reproductive health provider.